The next presentation is going to be on the Little Hans case and the questionable foundations of Freudian Oedipal theory. Dr. Jerome Wakefield is university professor, professor of social work, and professor of psychiatry at New York University, an honorary faculty at the Institute for Psychoanalytic Education. Dr. Wakefield is the author of All We Have to Fear: How Psychiatry Transforms Natural Fear into Mental Disorder, and 200 other publications in psychology, philosophy, psychiatry, psychoanalysis, and social work, dealing with issues at the intersection of philosophy and the mental health professions. Dr. Wakefield.
Thanks very much, Brian.
Okay.
Thanks. I'm delighted to be here. I've got to say that following a talk about the threat of nuclear annihilation with a talk about Little Hans and his Whittler, it's challenging. That's a difficult act to follow. So both of them involve one common element: anxiety. So I'll do my best to consider this and what's interesting about the Hans case for us today. This is a major project I'm undertaking, so this is going to be a little scattered, and it's more going to be like a description of my project and then investigation of certain lines of argument to trigger conversation. Because I can't really outline even most of one of the arguments because the detail is so much. I did speak to this group 2 years ago. A few of you might have been here then. And at that time I talked about the Little Hans case, and I talked about power in the family and issues, Foucaultian type, gender-related issues in the case. That was all about why did it come out that the Oedipus complex had such a grip on our society for so long? Why was that so important to the public image and to the influence of psychoanalytic theory? Today is going to be a totally different topic on the same topic. It's going to be about the evidence. So I'm stepping back. This isn't Foucaultian. This isn't interpretive. This isn't clinical. This is, in a sense, this is really evidential. It's a different perspective. It's the question, why should we believe what Freud has to tell us, or should we believe it? Now, this might sound like, sort of alien to Freud, but it's not. This is exactly the stance that Freud himself took in this case. He started out the case explaining that we would love to have more direct evidence of the claims that we make based on adult analysis. And here it is. We're going to see in the full-bodied, flowering of a child's sexuality, how my claims about sexuality that I made in 3 essays on sexuality in 1905 can be seen and demonstrated rather than filtered through an adult analysis where necessarily the analyst is interpreting. Now, a critical question is, why have I chosen the Hans case for such detailed analysis? Why do I think it's so important? I published a bunch of stuff, so people who are interested, other lines of argument I'm not going to take up today. I've examined some of the most salient fantasies that Freud uses as evidence in the case, the policeman fantasies, the giraffe fantasy. I've looked at the relationship to Bowlby, and indeed my thinking about the case is much more influenced by Bowlby and attachment theory than it is by Oedipal theory. And I've looked using interviews that have emerged in the Freud archives of the principles in the case. I've examined some of the background and history or sophisticated gossip, whatever you want to call it, about this case and about what was going on, about the relationships in another article. So I've done quite a bit of other work that's different from what I'm going to talk about today. Right now I'm working to finish a 2-volume work on this case. Yes, it is a form of madness, no question about it. And this will be published by Routledge maybe towards the end of this year. The Day the Horse Fell Down is the work I'm going to be talking about today. I guess I've come to see the horse falling down in this case as really not the father but Freud, that Freud was in fact felled in a way by this case, contrary to the way he interprets it. But in any event, the other one is the more Foucaultian analysis, which is supposed to say, well, if the evidence for this theory was so bad, why did it have such a grip on us? That's Foucault's question, the question of what is the power in ideas? How do ideas have their appeal in terms of social values, in terms of the way we organize ourselves? That's a different topic that I won't be covering today. Well, I thought, this being a psychohistory group, maybe a couple of picks of the major figures would be fun. Here's Freud in 1905 when he wrote the 3 essays, published the 3 essays on sexuality, in which he stated the Oedipal theory. Here he is in 1909, the year that the Hans case was published. That was during his visit to Clark University, his visit to the United States. Here is Max Graf, Hans's father. Little Hans was actually named Herbert Graf. Max Graf was a well-known writer and musicologist, and he was a follower of Freud. Here you see him. This is critical, if we get to it, for something later. This picture is of him with his glasses on. I could not find a picture with him with his mustache. This was later. He's somewhat older here than at the time of the case. Turns out the mustache and glasses play a role in the case, as you'll see if we make it to that point. Here is Hans's mother, Olga Honig, and Hans. There when he was obviously younger than the time of the case. The time of the case was when he was late in his 4th year, between 4 and 5, right at the end of the case. His 5th birthday occurred. She had had a very troubled childhood, which I won't go into. She had been a patient of Freud's. She had a lot of bitterness towards Freud for quite good reason. She had seen Freud during his period of the seduction theory of neuroses. Therefore, Freud had forced on her an interpretation of her problems that somebody in her family must have seduced her. Her father had died when she was quite young, so it could only have been one of her older brothers. Two of her older brothers actually committed suicide for other reasons. The idea that she was now casting aspersions on them as having sexually abused her caused her great distress, but she kind of bought it for a while. At that point, apparently, her mother cut off paying for her analysis with Freud due to the horror of this idiotic interpretation. So now, years down the pike, her husband's a follower of Freud, her son has problems, her father is using Freud's interpretation, and what's she thinking? She's thinking, this guy screwed me years ago. He doesn't even believe what he told me. He's saying that was false now. He's saying he foisted this thing on me and kind of destroyed my relationship with my mother. So her bitterness was really quite well-founded. There's Hans when he's a little older and closer to the case material. Somebody cleverly put, there's no such picture. Freud actually saw the boy during the analysis only once. It's the father, Max Graf, that performed the analysis at home with Hans and took detailed diary of the analysis as they went along. But somebody cleverly, there's Max Graf when he's older. That's Herbert Graf. Little Hans, when he was older, he became an opera producer. There he is with Marian Anderson, working, and with other opera stars. Here's Freud with little Hans, actually. So he was close with the family and knew Hans. And in fact, after the case was over, brought Hans a little rocking horse as a gift in honor of Hans having overcome his fear of horses during the analysis. Anyway, I was going to say somebody cleverly put Freud and Hans together in a psychoanalytic situation. This never happened, but it's kind of cute to see. In fact, during the analysis, they only met once. The father and Hans came to visit Freud once for kind of a tune-up for the analysis. But other than that, the father performed the analysis. So when I say this is an evidential look at the case, why should we believe it? What is Freud's thesis? What is his evidence? And should we believe him? And what's the structure of the argument? Now, it may seem absurd, more than 100 years later, in one of the most examined cases in psychoanalytic history, one of the cases that's presented most often in analytic institutes, often 2 or 3 times, to illustrate various points. the psychoanalytic theory of phobias as displaced anxiety, you know, from a repressed object. Obviously, the prototypical case of the Oedipus complex, the first supervisory case, Freud supervises the father, the first child case, of course, to which all future child analysts, including Melanie Klein and Anna Freud, refer, and they talk about it in you know, admiring tones. What possibly could we add by looking at this case and looking at the evidence and the argument? And the answer is that because the case has been looked at over and over again, mostly from the perspective of the clinical interpretive perspective, in fact, you'll have to trust me on this, in fact, the actual structure of the argument as an argument to convince somebody who's not already convinced, it has not been really elaborated in great detail. So whether you're a Freud basher or a Freud defender, the argument has tended to fall into certain grooves that Freud himself established and certain other early critics established. And stepping back and saying, well, let's take a fresh look at the evidence that Freud puts forward and the nature of his argument really hasn't been done, and I think yields some surprisingly interesting and complex results. And that's the attitude I'm taking toward the case. I think this is important, even though the Oedipus complex has fallen out of favor as the central doctrine of psychoanalysis nowadays. The fact is it dominated psychoanalysis for 50 to 100 years. Freud's choice to defend the Oedipus complex in the case of little Hans basically set psychoanalysis on a course. Even though we may be, in the analytic field, may be rushing to correct Freud's errors, the public has this irrevocably burned into its mind that this is what psychoanalysis is about. And because it's come under disfavor and it looks very unscientific nowadays, this is costing us. It may be costing psychoanalysis its future. So it seems to me, just as in psychoanalysis, or just in a Foucaultian archaeology, dismantling the past, really understanding the past and how we got here, is a very important part of transcending the past. So I think it's worth looking at this in some detail. Now, so the reason I think the Hans case is so important is simply that I think it was really a transition point. It hasn't been recognized as such. Philosophers of science and so on have said a lot about, and most philosophers of science think at some point Freud's sexual theory of the neuroses went wrong. And it became some kind of pseudoscience. In order to defend it, he had to have all these auxiliary hypotheses that seem very ad hoc. Well, other emotions seem to cause neuroses, as his critics were saying since back at Breuer's time. Well, then other emotions are probably really sexual energy moving around in various ways, and so on. It seems like a very ad hoc theory to defend a thesis. And so the philosophers of science have generally argued that Freud went wrong at some point here. But where they say he went wrong seems to me to matter. I think he went wrong much later than they do. I think he was doing good speculative science. I think he was doing what theorists do. He was a brilliant theoretician. I think he contributed a lot to theory and to philosophy of mind for that matter. But on this particular topic of the sexual theory of the neuroses, I think he went wrong in the Hans case. I think the 3 essays on theory of sexuality was a brilliant attempt to save his theory, but it had no empirical warrant really, and it was the Hans case where he tried to save himself. And show everybody that he was right. Now, I'm not going to go into this in great detail, but I tend to use Imre Lakatosh's philosophy of science to explain this. Sorry, I'm just going to have to talk about this because too much material there. Lakatosh was a philosopher of science that attempted to put together the insights of Karl Popper and Thomas Kuhn, who were directly opposed in philosophy of science. Popper said it's all logic, and the only thing you do to advance science is to falsify theories. You find a way of testing a theory to show it's false, and when you show a theory is false, you have moved ahead, and then you can construct a better theory. It's all very logical. Thomas Kuhn said, different theories are different worlds of interpretation unto themselves. They're like changing theories isn't logical, it's a paradigm shift, it's like buying one ideology instead of another. This is caricaturing both of them a bit. But the point is, these were very opposed theories, and Imre Lakatos came along and said, I think there's something true in both of these. And I'm going to put them together in some amalgamation that explains how science works. Now, the reason this is relevant to Freud is because I think Lakatos has technical difficulties, so most philosophers of science have not embraced Lakatos today as the final word. But on the other hand, how he thought about things, I think, illuminates Freud's situation. What was Freud's situation? Freud's situation, sorry, we'll get to types of evidence in a minute. Freud's situation was this. He had put forward the seduction theory and argued vigorously for it. He said he had all this evidence from his interpretations. Then he admitted the interpretations were incorrect. The seduction theory was incorrect. Now, two opposed criticisms of Freud had been prominent since the beginning. One was a suggestion objection. You're just suggesting this, your aggressive manner and interpretation, you're suggesting this to your clients. So of course they're coming out with these seduction scenarios. Freud's admissions seemed to confirm this. His very method, this wasn't just a disconfirmation of the seduction theory, this was a question mark, a challenge to the very method he was using, his interpretive method. So that's one problem he had, a basic problem. Because how does he get from there? He can't say, oh, now I've done 300 more adult analyses, because the very method he was using in adult analysis had now been called into question. They would just say, sure, you did 300 new analyses to show a different theory, because now you're suggesting that theory. We all could see that you suggested the earlier theory. Why should we believe anything you say now? So there was the suggestion objection. Secondly, what I'm going to call for short the fright theory. I mean, right back, starting with Breuer, Lowenfeld, Freud has articles trying to respond to Lowenfeld. People had said, look, what's this, and we can see it's a Victorian obsession. I mean, what's this Victorian obsession with sexuality as the universal cause of neuroses? Obviously, people have frights. Today, we all accept this, right? People have horrific, traumatic experiences that aren't intrinsically sexual, and they develop neurotic symptoms. By narrowing it all to sexuality and thinking this is your claim on immortality, that you discovered a universal theory of the neuroses, you're basically just making a false claim that doesn't have any basis in evidence, and in fact, you are ignoring what we all know, namely that other emotional difficulties can cause neuroses. So that's the fright theory. That was there, and Freud was arguing against it since the very beginning with the seduction theory. It's still on the table, and now that the seduction theory has failed, it's really on the table again. Okay? So Freud is kind of in a jam. A classic case of your theory having been disconfirmed, alternative rival theories look like they've been confirmed, you're dead in the water. It's the end of the sexual theory of the neuroses. Now, Freud, being the brilliant theoretician he was, he actually managed to try to wriggle his way out of this in a way that could have saved the theory. And it did, actually, as far as his followers and as far as psychoanalysis goes, it did save the theory. And as we all know, what he did was, using some experiences from his own relationship to his parents in what's called his self-analysis. If you look at it very closely, whatever he says in his letters and so on, it's pretty thin evidence, but okay, leave that aside. He came up with an alternative theory that the Oedipus complex is the explanation for everything. He had not been suggesting the evidence that people brought forward was correct, but of course it had been framed as actual events because they were projecting fantasies that they had spontaneously had. So in a certain sense, he didn't suggest the content of these fantasies. It was just whether they actually happened that got mushed up. So he's trying to evade the suggestion objection, and he's trying to evade the fright objection, saying, look, it turns out it is all sexual, but it's just that it wasn't seduction, it was actually spontaneous sexuality. So we all know that. So the Hans case, okay, so he suggests this. Now, what Lakatos argues is this. All the time in science, you get disconfirmed. Your theory's falsified by something that comes up. Unlike what Popper says, scientists do not give up their theory at that point. That almost never happens. What scientists do is they look at the overall theory and they find what Popper called the periphery or the protective belt of stuff that they're willing to give up because they want to maintain the core of their theory. And so you say, ah yes, well this does disconfirm this peripheral point, but by adjusting the theory, I can incorporate this disconfirmation and save the theory, right? So we all understand this because we do this every day. I mean, we're all moving around evidence to protect our core fantasies, our core values. You know, oh, my partner is irritable because they're undergoing this, rather than, oh God, I married an irritable partner. So, you know, we're all moving around the evidence to seem situational with auxiliary hypotheses to save our core fantasies that make us feel comfortable. Scientists do the same thing. Now, so so Freud then is seeing sorry, I want to go back to Lakatos for a second. Here's what Lakatos says. When a scientist does this, the danger is it's merely ad hoc pseudoscience, right? This is in another name for saying, well, you disconfirm me, but I can explain why and why my theory is still true. Another name for that is pseudoscience, where you keep retaining your theory no matter what the evidence against it, right? So how do you tell the difference between pseudoscience and legitimate movement of science, where you incorporate new evidence that seems like it disconfirms your theory? Lakatos said, well, this is where it gets a little tricky, but there is a way you can combine these ideas. What a scientist does is he protects the core and he abandons the periphery. And to do this, he creates an ad hoc new theory that seems like it could be pseudoscience because the only reason for believing it is to protect the theory. So how do you get out of the pseudoscience accusation? You must, at that point, make a novel, unexpected, surprising, new prediction. If you can show that this really leads to something that nobody expected, then you have a claim to saying this isn't just ad hoc. This is actually progress. I have shown you a new way that's actually illuminating. Now, B. Freud, in about 1900 or so, a little before, when he realized that the seduction theory was wrong, he's got to find out a way out, and I've explained how he did that with the Oedipus complex. On the surface, the Oedipus complex is straightforward pseudoscience. You have taken a disconfirmed theory that you were totally committed to. You've concocted a very weird, very unlikely idea about incestuous desires and spontaneous infantile sexuality that, if it's interpreted in a tortured way, is going to save you from all these obvious, better alternative theories. It's nonsense. It's pseudoscience. You're dead in the water. There is one way Freud can be saved if you think about the Lakatoshian analysis. He has to do something new, something fresh, something that will convince people. And that's the Hans case. That's why I see the Hans case as so critically important. What Freud says is, at the beginning of the Hans case, look, I know that nobody trusts, this is a gloss of my own gloss. He kind of says this. It would be great, even if you're an analyst at this point in history, if we had some direct evidence of this. You know, just doing adult interpretations is sifted through interpretation. So now we can read between the lines. All my opponents now say it's been proven it's suggestion, so forget anything you say about adult analysis. I've got to come out of that circle and give you something that's fresh, novel, and unexpected. Well, If it's true that a 4-year-old or 5-year-old boy can be observed and directly seen to confirm what was written in the 3 essays on sexuality, more than that, if this boy, by pure chance, after the parents have started keeping a sexual diary, should develop a phobia, a psychoneurosis, and then you could actually show from the case material, because uniquely we have a diary before the neurosis occurs, right? Then we have the neurosis occurring. We actually have information before that's independent of Freud. The father is keeping a diary. If you can actually show me that your theory predicts things that no other theory would predict, then I will have to stand up and say, this has to be taken seriously. Without the Hans case, in my view, the Oedipus theory is pseudoscience. With the Hans case, if it's as Freud says, that in this 4-year-old boy, he has made a universal prediction that no other theory would predict, that this boy would have sexual activity of certain kinds, and that when the psychoneurosis developed, certain kinds of things would happen sequentially, very detailed predictions, then you have to say, that is so unexpected, that is so novel, that maybe there's something to this. We can't throw it out as sheer pseudoscientific preserving the sexual theory of the neuroses at all costs. And that's exactly what Freud does. Now, I just want to say, there's a load of different arguments that have been put forward for the Oedipus complex theory. Freud's self-analysis, lots of legends, the Oedipus play and the Oedipus legend itself. Anecdotal evidence, right? Whenever you get into this and say you don't believe in the Oedipus complex, you say, oh, my patient just came in and the boy said, I want to marry mommy, and that's proof of the Oedipus complex, and so on. I obviously, in this brief span today, I'm having trouble even getting the basic ideas out. I can't cover all that. What I've decided to do is, I think there are concerns about every strand of evidence there. But what I'm doing is looking back at Freud's argument in the Hans case that he claimed should be convincing. So initially, the Hans case was simply a diary of Hans's sexual development. He wanted parents, his followers, to keep diaries of their kids to show that what he said in 3 essays on sexuality about child development was correct. It really wasn't a test of his sexual theory of the neuroses. And Hans's diary was particularly good, as we all know from reading the case. He was very interested in his whittler and the whittlers of animals and other such things. So his sexuality was quite blatant. He also loved cuddling with his mother. Freud interpreted that sexually. I call this the sexualization of attachment. Personally, I think Freud supported his theory by sexualizing what we now recognize as Bowlby-type attachment theoretic behaviors. And the sexualization of attachment was a very, made it, certainly gave more substance to the incestuous desire theory that he was putting forward. So the case is complicated for Freud by the following fact. When Hans's neurosis begins, it appears that Freud must have been salivating, one can only imagine. Because here's a kid who's been showing sexual stuff about whittlers and mother and this and that, and then he develops a phobia. And there's no record of any trauma. There's no record of anything to meet the criteria of his opponents who have the fright theory. He's thinking, oh my God, I've reached the promised land here. This is going to prove to everybody that sexuality is the essence of this thing. I can only imagine, I've tried to imagine, thinking about Freud's personality, his nature, and so on. The case starts in January. Sometime in April, towards the end of the case, really, Hans still has his fears, they haven't abated yet. Hans tells his father, the analyst, about a horse accident he witnessed right at the beginning of the case. And he says, that's when my fear started. In other words, Freud is getting this diary from the father, you know, every few days. He didn't have it ahead of time. So sometime in April, he's been working on this, thinking, oh, this is great, this will prove it all. And then in April, he gets this installment which reveals that there was just the kind of event that all his opponents said would have happened. A frightening, traumatic event that has to do with fear, not sexuality. A horse falling down in the street. Freud's writing up of the case was really an attempt to evade his opponents exploiting this. And if you look at the case carefully, you'll see how he does it. I can't go into it in great detail today. But it'll come up as we go through the remaining things I want to say. You know, when he realized that this accident is going to throw a wrench into his plan to make this his exemplar of the sexual theory of the neuroses, he tried to spin the case in various ways. He tried to argue that the neurosis actually started before the phobia, before the accident, a day or two before that the child had undirected anxiety. And so the accident was a precipitating cause of the phobia. This is his argument, was a precipitating cause of the phobia. That is to say, it shaped the directedness of the anxiety, but the anxiety had already existed before. Now this is an argument he had used before many times in responding to the fright theorists. He said those are only precipitating causes, not the real etiology. So to evaluate this argument, one has to look very closely at the beginning of the neurosis and see if he's right. Because if he's right, that is a good argument. I mean, if Hans had the neurosis before the horse accident, but it was undirected anxiety, this would be consistent with a Freudian vision that something happened like repression. At this point, it would be actually repression of sexuality. Later on, it might be repression of castration, anxiety, whatever it is, which liberated anxious tension that might be undirected transitorily, and then the horse accident would have directed it onto horses. That would be very interesting evidence for a Freudian versus a fright theory kind of approach. It's a good argument, if it works. So one has to look very closely at whether Freud is right about when the horse fell down, ergo the name of the book, The Day the Horse Fell Down. It's a 100-year-old mystery that has not been resolved. People on both sides just assume their respective answers. People opposed to Freud assume that it all started after the horse accident. Freudians keep recurring to Freud's statement that it started before the horse accident. I think this can be resolved, but unfortunately I don't have time to do that today. What I want to do today is look at another argument. I want to explain to you, so I see four rival theories are in play here. The fright theory, suggestion theory, Bowlby's attachment theory, the modern way that one might see this case, and Freud's Oedipal theory. Now, I want to just give you examples of the kinds of arguments that one gets if one actually tries to look at Freud's arguments, and they're brilliant. The arguments are brilliant, and they have not been adequately appreciated. Even the critics have not formulated, have gone over this with a fine-tooth comb, have not formulated them carefully to critique them, even Volpe and Rachman in their classic critique. So the first argument, I think, is the most direct, positive argument in the case. In other words, it's not defending against the fright theory, it's not defending against the suggestion theory, which many of his arguments are. But this argument is one, independent of all that, that argues specifically and positively for the Oedipal theory. And I'm going to call this the repression argument. And this is a beautiful case. Actually, it's probably, you'll be able to come out with 25 earlier, but I don't know of any clear n=1 kinds of arguments in psychology, other than just, sloppy kind of case things. But I don't know of any neat n=1 arguments in psychology before this. This is one of the neatest n=1 case analyses that one could imagine. What Freud says, in a nutshell, is look, if I'm right, then we should see a sequence of sexuality in Hans that is not predictable on any other theory. And I could go through the other theories. Bowlby doesn't predict it. I'm not going to go through them for time reasons. The fright theory doesn't predict it. The relationship to the horse accident doesn't have the same relationship. Only Freud's theory predicts this, and it's a wild prediction that one wouldn't expect to see. And the prediction is this. If I'm right, Freud says, now here's what we should see in this case. Since we were monitoring Hans before the phobia began, we should see an increase in sexuality in Hans prior to the phobia. An increase in sexuality. I'll explain what he means by sexuality in a minute, because in a 4 or 5-year-old kid, that operationalization becomes disputable, controversial. But we should see an upsurge in sexuality. Then we should see some evidence of conflict and repression. And so there should be some point at which you see him trying to repress or get away from his sexual feelings. And probably the single most important point, the third thing we should see is the symptoms emerging, and simultaneously with the symptoms emerging, a decrease, proportionate decrease in Hans's sexual expression. That is to say, for Freud, core point, the symptoms are a substitute expression of sexuality. And if you're going to have this theory work, then you should have what the symptoms increasing as sexuality decreases. And that's how Freud spins the case. Now think about it. This is a pretty kind of neat, precise prediction if you can operationalize sexuality. Now, it turns out Freud operationalizes sexuality. So here's the predicted sequence. Heightened sexual desire, internal conflict, diminution in sexual striving simultaneous with symptom formation. And you can put the horse accident in here as a precipitating thing. You would get the heightened desire, you'd get the repression, and then you get the horse accident happening in a way around then that directs the anxiety in that form. So you can actually put the horse accident into this schema and make it all work. So what's sexuality in a boy? Now I'm not going to argue with Freud about this because I think if he can make this work, that's pretty impressive. So he has a bunch of implicit, I had to pull these out of his various arguments, but he had a bunch of implicit arguments. But let's just take the first two are the most powerful by far. The first one is Hans's self-touching, which goes on in the case of his penis, what he call masturbation. That's one manifestation of his sexuality. And secondly, his verbal or behavioral expressions of wanting to be with and to cuddle with his mother. Now, I grant you, and I grant myself, I think that was a misinterpretation. That's a sexualization of attachment. But Freud is theorizing here in a way that goes against what you'd expect on attachment theory. I say let's grant him, for the sake of argument, his measures, and let's see if he can make it work. If he can make it work, it's shocking and surprising and goes against what we'd expect. There are other things, but they're minor relative to these two. These are the big things in the case that are reported by the parents regularly. There's fantasy evidence. I leave that out because I've dealt with the fantasies separately, and they come through an interpretive filter that again raises all the methodological questions that Freud is trying to evade with this direct evidence. So the question becomes, so first of all, I don't know if I've made a convincing case for Freud on the brilliance of the argument. It's quite an interesting, brilliant argument, I think. If the case takes this form and you can show this, it's as good as any N equals 1 argument I've seen. Now, so I can't do that today, but just let me summarize. If you actually look at the case with fresh eyes, you take these measures that Freud cites in his various arguments, and you go through the case and look, is Freud's prediction borne out by the actual case material? And the answer is it is not. So I would take, there are 3 predictions. One is increase in sexuality in the months prior to the actual occurrence of the symptoms. Now, Freud cites some things. He cites some reasons why Hans would have increase in sexuality. They moved to a new apartment. He didn't have his same playmates. And so Freud says he directed more sexuality onto his mother, and so on. But if you actually look at the record of comments about Freud's masturbation, about Freud's wanting to cuddle with his mother, and map those as they are referred to in the case prior to the actual time of the symptoms, what you find is that even in Freud's own comments, it appears that these are fairly constant. It is true these various things happened. He was alone with his mother in Gmunden when the father went on business, and that's supposed to bring out more in him and so on. But if you actually look at the measures of what is said about his behavior, the behavior appears to be fairly constant without a dramatic upsurge. Okay, that's probably the weakest of the three predictions. The second prediction is there is a period of conflict that is immediately followed, and the third prediction, I put that up here just to jump ahead, the third prediction is the most powerful of all, and most anti-intuitive, counterintuitive. After the symptoms begin, does that follow a period of conflict, and is there a marked diminution of sexual activity on Hans's part when the symptoms begin? That would be very interesting evidence. That's not predicted by, let's say, Bowlby. Take an example. For Bowlby, fear and fright lead to a desire for soothing. Hans's desire to cuddle with his mother should go up when the symptoms of anxiety begin, not go down. So Freud's thesis that this is sexuality and that you're taking from sex to give to the symptoms is actually quite opposed to what Bowlby would predict, and similarly for the other theories. Okay, and the answer is that Freud says that it's obvious that this is confirmed, but in reality, if you actually step back from what he says and look at the actual text, there is no confirmation. In fact, Hans was certainly struggling to repress his desires because his parents were threatening him and putting him in sacks at night and generally carrying out Victorian torment to stop him from masturbating, which they thought was actually bringing about the horse phobia because of its arousal of sexuality that got transferred into symptoms. So he has anxiety for sure, but as the time goes on, as symptoms become worse and worse, there is no diminution in sexuality. Without going through the details, which I document in the appropriate chapter in this work, when you actually look step by step at the case, he is continuing to masturbate. 2 months after the symptoms begin, he comes in and says, well, I'm still putting my hand to my whittler every night. His desiring to cuddle with his mother does not diminish in the slightest, but becomes a continuing issue with the father. So the prediction Freud makes, and in the case he actually claims that this prediction is confirmed, is simply false when judged against the data of the case. Now, so there's like 6 arguments like this that need to be spelled out, evaluated. I think a great puzzle about this case is how Freud could be so brilliant at formulating an argument. I actually think this argument's brilliant. I mean, it would have been persuasive if it was true. How Freud could be so brilliant in formulating a prediction and so dismally a failure at checking whether the prediction is confirmed or disconfirmed. This is, a basic failure, and obviously we can argue about whether this was conscious, whether he was lying, as Frank Triafi said, or whether he's like any scientist, hard to see the disconfirmations when your very theoretical legacy is at stake, or whether he looked at it through his eyes and really saw it the way he saw it, what the story is. But I'm not worried about that, because I'm more worried about what happened And the answer is, Freud's argument was brilliant and persuasive, but his checking the argument against the data was completely inept and incorrect, and therefore, let's taking this argument as a prototype, the case should have said to him, this is wrong, the Oedipal theory is not a universal theory. If Freud had done that, psychoanalysis would have had a different course, I think a better course, because then the emphasis would have been on meaning and not on what I call his nomological hermeneutics, which imposed in an authoritarian way a certain central idea about what all people who are having neurotic symptoms must be feeling. If we had skipped 50 years of that, excuse me for those of you who believe in it, of that nonsense, then it seems to me psychoanalysis would now be in a much stronger position. I mean, take one example, I think cognitive behavioral therapy would be a branch of ego psychology. I don't think that the division between psychoanalysis and many other forms of therapy that are concerned with meaning is an artifice to some degree of this moment when Freud could have said, okay, forget about this craziness about sexuality, I'm going to say that meaning in general is relevant. That's my contribution. We would have had a different look to the field today. By embracing this, we have a situation where the contribution of psychoanalysis is threatened by its history of this kind of silliness. I'm just going to mention one other argument to give you an example. Another argument he puts forward is the detailed, this is again an argument that goes back all the way to the seduction theory. How can you tell if it's the horse accident or an Oedipal conflict that's causing the phobia? After all, the phobia is about horses. And the answer is, you look, Freud's answer always had been, you look at the details of the fear, and you will find inscribed in the details of the fear things that are inexplicable without bringing in the broader meanings, that are inexplicable just on the basis of the horse accident. And so he spends a lot of time in the case looking at the details and saying this detail, you have to bring in the Oedipus complex in order to explain this detail. Why is he afraid of horses like this rather than those when he just saw a horse fall down in the street? And again, one can take an evidential view of this and say, okay, that's actually quite a legitimate argument. If the explanation of the symptoms requires that we bring in Oedipal meanings, and there is no explanation in terms of the details of the horse accident that frightened Hans, then a reasonable person would say an alternative theory should be seriously considered. But I can't go into it today, but it turns out when you look at each detail he brings up, this doesn't happen. The most famous detail is that Freud says, look, you're afraid of horses with blinders on them and stuff like that, and your father wears glasses and has a mustache. This detail must be explained by the Oedipal fear that I'm postulating. But the problem with that is that probably the horse he saw fall down and became afraid of as the horse kicked and tried to bite probably had these on, pulling a bus in downtown Vienna. And frankly, even I find those a little frightening. I think these kind of details, it's hard to find details that can't be explained by the probable details of the actual accident. Freud jumps to the fact that they can't be explained. But if they can all be explained, then he has a very weak case, this detailed acquaintance with the nature of the phobia. Okay, unfortunately, that's all I can say today about the kind of overall case I'm making, and now we can open up to discussion, and I can get your impressions. Thank you. Sure.
Yes, I take issue. I disagree with you in your approach of calling Freud's approach silliness, and absolutely there are contributions of psychoanalysts since Freud which have expanded our awareness of the self-psychology in the psych.
I didn't call those silly.
Excuse me?
I only called, at some point, I dismissively called the Oedipal theory, so maybe I shouldn't have used that kind of dismissive language, but I certainly didn't call any of those other things. I said these other things are fighting against the heritage of Freud. That's what I was saying.
But, for example, the blinders, you would try to understand the significance of the blinders based on free association of the patient. And these details do matter, along with the feelings that go along with it. That's part of the whole process.
Absolutely, in a clinical situation you would. But Freud used this as an argument that we should believe in the Oedipus complex because the horse accident couldn't explain Hans's fear. Now, the question is there anything about the horse accident that might explain that he's somewhat more afraid of horses with blinders and muzzles? You know, I'm more afraid of dogs with muzzles than I am of dogs without muzzles because of what it evokes. The question here is, what is the evidence? It's a different view, I agree, than what the view you're taking. Free association, it's useful. I still use it. I love it for analyzing dreams and so on. But it doesn't prove a theory always. Sometimes Freud himself saw that you needed direct evidence of certain kinds that would convince people because the analytic situation with its free associations is filtered through a tremendous amount of interpretation that's already shaped by your theory. So you need some kinds of independent evidence, and in the Hans case, that's what he claimed to be giving. At the beginning he said, we would like some direct evidence. So I'm looking at this a little differently. I don't mean to be dismissive. My whole point actually is, I think, congruent with what you're saying. What I'm saying is that we in the field of psychoanalysis are struggling to this day to construct a theory that isn't tainted by some of Freud's earlier incorrect theorizing. And I agree with you that many of these theories are advances. Yes?
In the paper that I'm going to be giving here tomorrow morning, I want to argue that we have to expand the Oedipus complex to include Laius and Jocasta, and that I think, like you, I guess, that Freud went off in the wrong direction. But in my case, I want to argue that he left out the parents and put all the onus on the Oedipal child. And here I work from people like Lowell and Martin Bergman and George Devereaux. But about your horses, it seems to me there were probably almost as many horses in Vienna in the 19th century as people. And I would remind you of Raskolnikov putting his arms around the horse falling on the street, talking about it being whipped to death by the driver. I would remind you that Nietzsche had exactly the same experience in 1889. This was a common phenomena that horses were beaten to death in public and would fall and collapse if they didn't get up, they were beaten. So it seems to me that you're being a little, I mean, it wouldn't work with a car, because cars don't have anything but what, exhaust pipes?
I don't think there were, I mean, I have photos, I'm not going to try to find it now, of a Vienna station. There's all the horse-drawn carriages. Horses were everywhere.
Yes.
That's what made the phobia so difficult and so problematic, and why they
fall
consulted
down
Freud.
all the time.
However, Hans never had any fear before he saw this horse. The father, when he heard this from Hans, checked it with the mother, who was with Hans at the time. And in fact, she said, yes, Hans is exactly right. He had no fear before that. When he saw this horse fall down, kick, whinny, try to bite, that's when he got his fear. I don't think causation can be, you know, I think the behaviors are quite on good ground at saying, maybe there's some causation here. I don't think you can say just because there were horses everywhere, therefore it has no causal force.
Of them to fall
Right.
and be beaten.
Well, he never was afraid before, so this has some
called a
relevance.
trigger.
Now, I get into
Okay,
more.
I want to get to more questions.
Yeah.
So I'm wondering, can I take maybe 2 or 3 questions? at a
Sure,
time?
but let me just answer.
Okay,
Take
yeah,
one
sure,
thing.
sure.
I actually agree with your, the burden. So we'll probably be overlapping on what we're saying. But what I talked about here 2 years ago was exactly the power, the role of the father, the role of the mother, and how so if you want to call it Laius complex, whatever you want to call it, the point is that's the essence of the case, not the child's fears.
Right.
Okay, so we can only take a few more questions because we only have about 10 minutes. Can I just get a show of hands how many people would like to ask a question? Okay, so why don't we go in order? Trevor, David, Ken, Guy. Is there anybody else that wanted to ask a question? Can we take Trevor and then David, and then we'll do Ken and Guy? Okay.
Later on, Freud has said the Oedipus complex included all triangles. So, like, you know, it's not just kill
Yes.
the father and sleep with the mother. And also, he emphasized in inhibition symptom of anxiety, castration was like one level of anxiety, and then loss of the object was another, right? Separation. So basically, any social situation you could have anxiety in is castration anxiety. You know, he just uses it as a kind of term. And so, if love of the mother is like the Oedipus complex itself, you know, like, where you only get so many chances of love in life before, like, you know, you get betrayed, you get cheated on, all these things happen, and then you start to shut down. And then, so with a lot of my patients, you know, it's like love is not possible for them. It's like, so they have a lot of pseudo relationships and sexual relationships with people, but they're not emotionally vulnerable to them. So the Oedipus complex for me, and what I see it in Freud's work, is that, you know, you're open to the world, to finding your love, your success. You get enough ego injuries, narcissistic injuries, and you start to shut down. And so in this case, you know, I think that there might be some kind of relation between a sexual relationship in and of itself, not including love, and the creation of a phobic symptom. But I mean, I think to examine the Oedipus complex as Freud means it is to say, like, what is little Hans's capabilities of loving, of having a full emotional relationship that way.
So not only your comment, but there are a dozen ways of trying to, quote unquote, save the Oedipus complex by reinterpreting it some way or other as a little broader than this very narrow, incestuous, sexual, specifically sexual desire for the mother, murderous rage and guilt and anger and so on, and at the father. The problem with all these, it's not that there's any problem with them. I mean, the Oedipus, clearly, from what's happened over the last 100 years, Freud's Oedipal theory has enormous evocative meaning to many of us, and obviously captures emotions that are of great interest. And as you say, in fact, Freud himself thought one of the arguments for his Oedipal theory was the division between sexual desire and love, and that this whole idea was due to conflict about the Oedipal object and so on. But in the end, the Oedipus complex is a way of saving Freud's theory. It is a theoretical structure. Without the literal interpretation, Freud's basic legacy of the sexual theory of the neuroses, I don't consider that the important part of his legacy, I consider unconscious meaning the important, but what he thought was part of his immortal legacy goes down the tubes. I mean, he has no other explanation for how, I can't go into it now, but he has no other explanation for how all neuroses can be caused by sexuality without having some kind of crisis at about that age, which forms your, which reformulates your sexual object in the right way. It's a complicated thing. It's why, it's easy for boys because they're already attached to the mother sexually, so they can be frightened enough to go find another female in typical heterosexual object choice. But females, he had to construct this whole labyrinthine theory with, penis envy and all this kind of stuff in order to figure out how they did it. His theory is under stress, and the Oedipus complex is constructed, not just this gross set of theses, but the details are constructed to get him out of this mess and show how it can all work. So I acknowledge that there are half a dozen or a dozen other ways of thinking about the Oedipus complex that make it interesting, make it clinically relevant. But does Freud's theory work? I say no, and that if you try to disengage that kernel that I've just talked about, it's not doing, his theory of the sexual theory goes down the tubes anyway. So I'm not disputing what you're saying, I'm just saying it's a different question of what was he onto emotionally that we can still take from it, but his theory was wrong.
Okay, so we have 3 more questions, but I need to ask you to keep the questions.
I'll try to be short.
No.
Okay.
I wish we could really have more time.
Right.
Keep the question to 1 minute, and could you keep the response to a minute?
I'll try to, yes.
Okay.
So more of a comment than a question, and I'd like your response to. Contextual and historical on sexuality, and why was Freud, one of the things you seem to be saying is Freud was obsessed with sex, which is what all his critics said. There was a reason. It had to do with Darwin. right? We're only 20, 30 years after Darwin, after the supreme importance of reproduction and sexuality in understanding the universe, in understanding biology, in understanding the animal kingdom, in understanding people. Freud's theory, sexual theory of neurosis, is only a part. He has a theory, sexuality is not just about neurosis, it's about everything. I mean, libido theory.
Sexuality becomes eros, right? Which
Yeah,
is all
and
kind of general
turns
stuff.
into error. So his need to have, you know, to defend his theory of sexuality, it is axiomatic. I mean, yes, he needs empirical evidence, and he tries to, because he's got critics and he's trying to convince people. But it's axiomatic. Of course, sexuality has to be the most important thing. That's what Darwin tells us.
Well, number one, I'm not sure Darwin really tells us that. You know, survival and reproduction are mentioned saliently by Darwin, and fright could be a threat to survival, so therefore maybe that's equally important. That's number one. Number two, I don't think it's at all axiomatic. Many of the other people who are equally familiar with Darwin around Freud said this is too narrow, this is absurdly narrow. Number three, this is a little getting off the point, but I'll just try to allude to this. It's a chapter in the second thing on power. But, you know, really Freud wasn't all that creative in doing this. If you look at Victorian sexual theory of pathology, they believed in semenic theory. There was an old theory that semen circulates through the body. Why does it have to circulate through the body? By the way, in case you don't know, you're wondering, why does semen have to circulate through the body? 2,000-year-old theory makes perfect sense. How could a child have its father's nose when the semen comes from the loins, unless the semen circulated through and took a little impression as it went past and then brought it to the loins and communicated it to the mother's material? So there was a 2,000-year-old theory about all this, but if you look closely at the logic of it, the semenic theory looks just like the theory of libido, except in the body rather than in the mind. Freud understood the idea. I mean, so this is very Victorian, really. Freud was preserving Victorianism in a certain way, while even as he was attacking it. Obviously, normal childhood sexuality was an attack on the Victorian vision. But they accepted childhood sexuality, but only pathologically, only when a child was seduced and so on. So the answer is, Freud chose this. Freud thought his legacy depended on it. Freud, yes, he thought it was more malleable. He had to have something extraordinarily malleable because he was trying to explain all the neuroses at once. Neuroses can take place in any part of the body. Neuroses can take place with a great variety of symptoms. Only sexuality seemed potentially malleable enough. But let me just say, you say, well, all these other theories, sexuality's everywhere, infantile sexuality, this sexuality, that sexuality. I think if you look at the logic of Freud's theoretical development, what you find is the tail is wagging the dog there. That is to say, each expansion of sexuality that looks like this beautiful vision of how sexuality is everywhere is really in the service of saving the sexual theory of the neuroses. That's why he postulates infantile sexuality to begin with, to save the sexual theory of the neuroses, since his patients' memories go back to childhood as he's free associating with them, and so on. The sexual theory of emotions, sexual theory of this and that. They are all kind of ad hoc theories to save the sexual theory of the neuroses. So I think one has to be careful here. Freud is a little monomaniacal about this. I mean, obsessed with sex is dismissive, but I think the logic actually runs that way.
Okay, two more questions, Ken, and then Guy.
Okay, I've got 5 points. One, Freud published the seduction theories in 1896. You announced them in 1897. Were there writers who said that this was suggestion then? When Freud renounced the theory, he said he immediately put fantasy as the reason for it. The Oedipus theory came later. Third, how do we know that Olga had this response to Freud that you said she did, and how do you make that she was close to Freud and at the same time resentful of him? How do you show that? 4, the theories of science that you're presenting about Freud were not Freud's theories. They were more, what you're saying is accurate, but it's not how Freud